to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome to Ask the Patient Advocate podcast, where we discuss all things related to navigating your health. Today, I wanted to share the journey of one of our clients specifically. Her name is Mary. Mary's story is an example of the power of patient advocacy and how it can make a significant difference in managing chronic conditions and navigating the complexities of the healthcare system. And today, with me on this podcast recording, we have Christine, who is a member of our team. Christine is one of our assistants, and she is an amazing part of our team, key component of our team. And our clients all know Christine because they talk to her very frequently as well. So welcome to Christine. How are you doing today?
Hi, I'm good. Thank you so much for the introduction.
Of course. Are you ready to talk about one of our patient stories?
Sure. Yeah, Mary has multiple chronic conditions and primarily was confined at home under home care. So her health is very sensitive and she has been in and out of the hospital frequently. And our team at Pathway Patient Advocates had the privilege of helping Mary through several critical scenarios. So today we will highlight some critical situations where we provided support and made a difference in our healthcare journey.
Awesome. Perfect. Okay. So, one of the first steps that I remember that we took in Mary's case was to introduce her to alternative treatments and provide thorough education on her health issues. Specifically, Mary had a really rare condition called multiple system atrophy, and that's abbreviated MSA. And in the past, this was also known as Shy-Drager syndrome. And so MSA is a rare neurological condition where the body's unable to adequately control autonomic functions. So that means like the functions that you don't have to think about. This includes things like walking or moving, breathing, your heart rate, your blood pressure, and even your digestion. So, this is a rare syndrome, and many people are not even familiar with it. And even Mary really was learning a lot about it as she went through it. So she really was interested in kind of understanding it better. There wasn't that many resources that she was familiar or aware of. And, without really knowing what you're dealing with, it's hard to really help manage it and figure out the best way to make your quality of life better. So we really worked on kind of understanding what we were dealing with initially, and then kind of seeing what resources are out there, and then what things are not out there that we got to kind of figure out and work together to kind of brainstorm of what we can kind of make the best of, and how we can kind of use resources that maybe aren't specifically commonly used for patients that suffer with MSA, but maybe we can, in her situation, make them more applicable. And so Mary and I became very good friends, and our entire team. It was great working together
Yeah.
with her. Yeah, it's just made a really good working environment because she knew that we were there for her. And I think that was a big relief off of her shoulders too, just to know that she wasn't alone in this, because it's a scary time, especially when you have any kind of condition, but let alone a rare condition. It can be a very lonely journey, and it doesn't have to be. So it really helped us help Mary have a new perspective and give her some hope as well.
Right. And I recall Mary mentioning that, Pathway Patient Advocates really opened her eyes, that we explained everything so clearly and introduced her to options she didn't even know existed. So she really felt more in control, in her health for the first time in years. So I bet she really loved, you know, what we do for her.
Yeah, no, 100%. I remember that too. When we first met Mary, she was very frustrated and exhausted, and her
Right.
condition was really poorly managed. Again, she didn't really understand it. There was also not really much treatment being offered to her, or management,
Yeah.
and we really spent a lot of time listening to Mary, understanding her concerns, and understanding her health journey and history in detail. And so, by highlighting the management options, Mary really saw a noticeable improvement in her condition. She was more engaged in her care and felt hopeful about managing her rare condition.
Right. So now, Elena, can we talk about how we help Mary find a new skilled nursing or rehabilitation facility for her?
Sure, yeah, that was something else we also did. So, another critical moment in her journey was when she got to the point where she needed more intensive care. So, initially, we really helped optimize what she could have at home. So we optimized her physical therapy both in person and virtually, and helped provide different resources that could address with stress management techniques, dietary changes, things like that, assisted devices, and so forth. And then as her condition progressed, because unfortunately, um, the condition does continue to progress, it came to the point where she really wasn't safe to stay at home by herself, and so we helped her make that transition into a nursing facility, a skilled nursing facility. And so she was really in and out of the hospital before this. It was really clear that that was time, and I think this is a pivotal moment for most patients when they have to kind of face the reality that, even
Yeah.
though being at home is the most comforting thing, it's not always the best thing, especially when safety comes into play. So, Mary's frequent hospitalizations were really disruptive and stressful. She needed a stable environment where she could receive consistent care and management. So, we worked closely with Mary and her family to identify a nursing facility that could meet her specific needs. And in her case, it really was going to be a long term facility. So, we wanted to find one that, was able to accommodate her and a place that she'd be able to feel comfortable calling home. So we did an extensive research. We considered factors like the facility's proximity to her best friend, who was really involved in her care, the quality of care, and the specific services that were offered. We arranged tours and meetings with the staff to ensure that Mary would be comfortable and well cared for. And I think the facility was really happy to work with us, knowing that Mary had us on board as her private patient advocate team. It helped kind of make their job a little bit easier too, and the transition smoother. One of the things that I know is really important to Mary is that she was able to bring her little dog with her, because that was really one of her closest companions and uh, comfort, right? And so they definitely were able to accommodate that, and that just made the world of difference to her because she was, not did not want to part with her puppy. So that was great that they were able to accommodate that. Yeah.
Yeah. Yeah. Yeah, but I remember Mary saying that, finding the right facility was daunting and she didn't know where to start. So us pathway patient advocates handled everything, and we found a place that was perfect for her and she felt confidence in her choice. So I think she really loves it.
Yes, yes, exactly. And I think a big question that we get is, there's a lot of different companies that will help, like they're kind of placement companies where they will help place
Right.
you in a different facility. Now, the difference between pathway patient advocates and what we do compared to that is that we do not have any kind of like finder's fee or get any kind of incentive from the facilities. So we really have no incentive to send you to a facility, other than a specific facility, other than to ones that we think are going to be the best fit for you, and that you express your interest. And we really do a personalized, customized approach. And again, just kind of circling back to like the difference between a private patient advocate and a different advocate or similar job that is bound to a healthcare system or insurance company. We offer a very non-biased opinion. Ultimately, our own main and only goal is to help you and have things done in the best interest for you. So that is something that we're able to carry throughout the whole process, is having you in mind and offering that non-biased opinion.
Right, right. That's perfect. Now, can we dive into how we help Mary find a new, primary care physician and outpatient clinic?
Oh, yes, definitely. So Mary needed a new primary care provider, and it was really important that she found someone that could manage her ongoing care effectively. And this actually happened before we transitioned into the nursing facility. But of course, we wanted to have that
Yeah.
provider be able to also continue with her as well. The current provider that she had was okay, but they weren't really specialized in rare conditions or chronic conditions. And she just wanted someone that could offer a little bit more and also have a little bit better sense of knowing that she could reach that provider when needed and things like that. So, her current status was okay, but she just wanted something a little bit better when it came to the relationship with her primary care and what they could offer. And so that's what we did. We really did some research and looked to see what options. We did a comparative analysis and sat with her and decided here, this is what's available, which ones, should we look into first and things like that. And it turned out to be really great. We were really able to find a new primary care provider for Mary that really accommodated her specific requirements and preferences. And we found a primary care provider that specialized in rare conditions and was really familiar with rare neurological conditions as well. This new team approach was really proactive and worked closely with us to ensure that she had great continuity of care. The office would schedule regular checkups and coordinate with the home care team to monitor her progress. And then, even when she transitioned to the facility, we were still giving them updates to let them know that they, what was going on and things like that.
Yeah. Well, as Mary once said, switching doctors was a big step, but it was the best decision. She also said that this new doctor we found for her understands her and takes her concerns seriously. And, she finally feels like she has a team working with her.
Yes, no, for sure. It was great. The whole process was amazing. So yeah, finding the right primary care provider significantly improved Mary's health management, and she had fewer emergency visits, and she really felt more supported in her day-to-day health care. And she was really able to focus on other things and not just always her health concerns. She was able to enjoy yoga and enjoy some different um, book groups and things like that. So I think that's great.
Yeah, and there's a lot of activities in this facility, and I remember she is very happy about it.
Yeah, exactly. So Mary's story is just one example of how private patient advocacy can transform the journey with a rare disease. And at Pathway Patient Advocates, we're really dedicated to providing personalized support to help our clients navigate the complexities of their healthcare journey. If you or a loved one are struggling with a rare condition or maybe even undiagnosed condition or need help navigating the healthcare system, don't hesitate to reach out to us. Together, we can make your healthcare journey much more manageable and significantly less stressful. So I guess that's it. Thank you for tuning in to Ask the Patient Advocate podcast. And until next time, remember that managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.